The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is Dr. Thomas O'Brien. For almost 25 years, I specialize in offering families an affordable concierge service to avoid paying costly medical insurance or unreachable deductibles without giving up premium health care. As an osteopath, I offer osteopathic adjustments alongside medical examinations. Also, I offer discounts to military and first responders. I am now accepting no-fault patients, which include osteopathic adjustments, medical treatments, and prescription services, including medical marijuana. At my practice, my patients never pay copays and still receive the most personal and complete medical care. I have spent my career devoted to providing healthcare at affordable prices. Everybody should have a relationship with their physician. I work for you and your family. The honor and privilege is mine. If you have been in an automobile accident, please call my office at 631-980-8200 for an immediate appointment. To learn more about me and my practice, visit drtomio.com. Again, I am accepting no-fault patients. Call my office for an immediate appointment, 631-980-8200. Welcome to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. Today we're going to do something special. I have a wonderful guest on my show, David Levenstein. He is the host of Back to Business.
Back to Business. Hey,
Back to Business.
How's everybody doing out there?
Everything's good. How's your New Year?
My New Year's wonderful, actually. And yours?
Pretty good. Yeah,
All right,
it was
great.
Quiet. We went out to dinner and just my wife and my twin.
You went out?
Yeah. Just relaxed, and that was it. And then came home, and I fell asleep, and I woke up 7 minutes before the ball dropped. My wife, Kathy, just gave me a little nudge. We watched the ball drop, and that was it. Went to sleep.
My wife and I stayed home. We watched Ryan Seacrest. I didn't know anybody. Maybe I'm getting older, but I didn't know one performer.
Right.
I said except the Duran Duran at the end.
Yeah.
But I honestly, I didn't know anybody. I didn't know the co-host. I knew nobody. TikTok sensation, all these people. I have no idea. We're getting old.
Yeah, exactly.
Speaking about getting old, let's talk about your practice. I'm very excited about your practice because I know I've been to other kind of doctors, chiropractic, and you got manipulation massages and things like that.
Right.
Now, as an osteopath, what I've read, and I pull these things up because when we were talking about it, osteopaths, like chiropractors, also offer manipulation to their patients, right?
That's correct.
Where chiropractors focus on the spine, is that?
Yeah, well, that's, they do manipulate other areas of the body, but basically they're focused on the spine. Yes,
Right.
Yes.
Where an osteopath takes a more holistic approach to their adjustments that look at the entire body.
Yes, that's the holistic
circulation, lymph.
You got it.
Healthy
lymphatic system.
Lymphatic system.
Yep.
All these things that make our body, run.
Yes.
All the other fluids and stuff that go around that oil our body, right?
That's a good point, because that's one in my show I discussed one of the pillars and the pillars of the concepts that Dr. A.T. Still developed, and that's called what you just mentioned there. It's called the artery reigns supreme.
Okay.
Artery reigns supreme, and what we do is we focus on being able to free up restrictions, so we have blood flow going to nourishment, oxygen, nutrition going to the body parts, the organs, the muscles, the brain, and we're able to remove the toxins, the breakdown product.
Right.
If there is a restriction in that, and that's an unhealthy state.
Right. So can these things be confused, like these muscle aches and pains, can be confused with some sort of injury versus the fact that your body is just not providing the nutrition and the blood flow and the oxygen that it's needed to function healthily?
Absolutely.
Right.
Yeah.
Interesting.
Yeah. And
And that's why the difference between an osteopath and because you're a medical doctor, there's so many times that people go to regular chiropractors, right, and get their manipulation, and then still are dealing with their even though some of the chiropractors are amazing, they still are dealing with the pain while undergoing their treatment.
Right.
And that's something that you can prescribe the right medications and muscle anti-inflammatories that regular chiropractors cannot to explain that.
Yeah, sure. Well, I'm going to give you an example.
Okay.
I have a friend of mine who's a chiropractor, and I was in her office, and she was presenting a case to me, and this particular patient kept coming back with low back pain. Yeah. And so we put the X-ray up, and I'm looking at it. I'm like, okay. So saying it's happening in this area, and she goes, yes. I said, and it just so happens the patient was sitting behind me, and I said, well, does the patient have diverticulitis? And the patient jumped up, yes. How do you know? So that is...
How did you know?
Well, because of we have what's called a somatic visceral reflex, and that's the spine and organ. And so when the spine's constantly out, or in this particular case, it was the visceral somatic reflex where the organ was ill, and it was sending a signal to the spine, and the spine, the vertebral body, kept rotating, and in that case they call it subluxation. We call it an osteopathic lesion. And I said, we need to treat the diverticulitis. I said, I bet you that's what's happening. And the guy says, yeah, how do you know I had diverticulitis? I said, I bet you have a flare-up right now, and that's what's causing the pain. And I said, go back to your GI doctor to treat it. Right. Now, and that happened to be the case.
Really interesting. Yeah. And now in one body, like that song, the shoulder bones connected to the whatever, right? Mm-hmm. This is what you kind of really talking about.
Yes.
I mean, all these connections that we're having and focusing on just one versus what an osteopath does is focus on the entire body.
Right. It's a holistic approach.
Like I know that my wife sometimes will go for acupuncture, right? Mm-hmm. And if her neck hurts, they put something in her foot because it's everything. This fluids are going through your whole body. Right. That is explain how that works.
Right. Well, in that particular case, that's meridian lines. Mm-hmm. We don't call them meridian lines because that's within the Chinese medicine, but that's the same pretty similar concept.
Right.
Energy pathways, it's all different terminology.
Right.
But with us, again, artery reigns supreme. We need good blood flow. If there's any restrictions, we have decreased blood flow.
Right.
Okay. And then we end up in a unhealthy state. So what I do is when a patient comes into my office, I do a thorough exam, history and physical, and then I do a structural exam, and I'm feeling for restricted motions. And I say, well, I have a pain in my neck, and I'll start to examine them, and I'll say, right here. And how do you know? And I said, well, because you don't have restrictive motion, you don't have ease of motion. Mm-hmm. I said, this is why you have headaches. Or, I was diagnosed with migraines and they keep giving me these medicines. I said, yeah, sumatriptan. Yeah, it's very toxic. And you're getting sick from it? Yes. I said, because this is not a migraine headache. It's a tension headache based on your neck being out of alignment.
So not tension like having stress, but tension where there's tension on your joints, tension on your nerves, things like that.
Yes.
That's interesting because I know people that suffer from chronic migraine headaches, and they're always going from medication to medication, to treatment, to Botox injections, to all that stuff. And it could be as simple as visiting your osteopath if you suffer from headaches and let him look at you from a different angle, from a different point of view.
Yeah, different perspective. 2 weeks ago, I had a patient that came in and they said I had ringing in the ear, what we call tinnitus. And actually, this is a case in my book. It's not the same patient.
Ringing like a high-pitched noise or a rumble or anything, really.
Yeah, exactly. And so I said, well, let me do a structural exam. And of course, C3, C4 was out. And that's the area that innervates this area of the
Where is
anatomy.
C3? Up, bottom?
Right, basically almost midway through, let's say halfway down your neck.
Can you feel that or you need an x-ray for that?
No. I palpate and I touch and I'm looking for...
So you can actually feel when something's out of line.
Absolutely.
Interesting. Okay.
Yeah. I do certain movements. In this particular case, I'm doing side bending and I'm going back and forth instead of rotations.
So you can watch someone and see how they bend their head and move their shoulder where the stress is?
Yes.
Interesting.
Yes. Yeah, that's a structural exam.
Okay.
And then I was able to, I articulated and I manipulated the cervical spine. I also did the upper thoracic spine. And no joke, I said, well, it might take a couple of minutes. Within 30 seconds, she goes, oh, that ringing, that sound in my ears is already... It's almost gone.
Really?
I said, yeah.
Wow.
So, yep. And so that was a case, but a little teaser. I do have that case in my book, but a different person.
Right. But that's interesting, though, because I think that, I always wondered what you meant by an holistic approach to medicine. Explain what that means.
Yes, well, I'm looking at the person holistically, the entire body. It's very important. I need to know where your mindset is, spiritually, mentally, and physically, because you need all three. Okay, if you're lacking in one of those, we're not going to have a good outcome.
How does spiritually help when it talks about physical? I mean, if you don't feel well, you don't feel well. What does your spiritual well-being have to do with that?
Yes, because you need to feel good about yourself,
right?
And then now we're leading into depression and going in that direction. Okay,
yeah.
So my key is to basically pump you up. I want you to feel good about yourself. I want you to trust in me, and I'm going to be honest with you and tell you I can handle it or not. And by you trusting in me, you're going to allow the energy to flow, and I'm going to be able to treat you. And by educating you, you're going to be more compliant, and we're going to have better outcome. We're going to be successful.
That's interesting, because I think, and I always felt that it's more than just someone saying, hey, do this. I wanted to know why.
Right.
The more we know, the better off we are, right?
Absolutely. All right, so we're down to the last 30 seconds. Okay, to learn more about my practice, go to drtomio.com. That's drtomio.com. As of February 2023, I will be offering new concierge where I'm going to be focusing on osteopathic manipulative medicine. It's a holistic approach. So if you have chronic neck or lower back pain, give my office a call. Involved in motor vehicle accident, give my office a call. 631-980-8200. 631-980-8200. Welcome back to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien, and I'm here with David Levenstein, host of Back to Business.
Hey, everybody. How you doing?
All right. So we were talking about my new business model and how I'm treating patients.
Well, you're an osteopath. It's not new, but this is going to be the focus.
Yes.
Because based on what you see, which I find interesting, what you see when clients are coming into you, what they're really more interested in.
Right, exactly.
And do you think people are more interested in the adjustment or the holistic approach to medical care, preventative approach, because they're tired of being prescribed so many drugs and tired of going under the knife as even an option? They want to try some other form of healthcare versus traditional medicine and operations?
Yes, absolutely. They come, majority of my patients are coming in for the manipulation.
Right.
A lot of them have been under the care of a chiropractor, and then once they come to me, they see the difference between the techniques. There is a difference in the techniques, and our techniques is a lot gentler, and then they get to spend the time with me versus a production line. That's one of the other benefits of coming to my practice, because my practice is limited.
Right.
And it's not a 5 minutes. I'll sit down and I'll talk to you. And that was one of the benefits. So I can get you in the same day, if not the following day.
But you're also a medical doctor.
Yes.
Right. So people don't have to only see you for manipulative services. They can see you as primary care as well.
Yes. That's an added benefit of being an osteopath.
Right. And even if someone doesn't have insurance, you've explained the concierge service. If someone doesn't have insurance or has insurance with a very, very high deductible, they can pay a monthly fee.
Yes.
And they can see you as many times as they need to per month, right?
Yes, correct.
Right. And receive prescriptions and receive top medical care from an osteopath who can provide medical services as well as manipulation, right?
That's
so
correct.
Talk about the different types of prescriptions that someone might need or require in order to give them a complete holistic medical and physical approach to their treatment and their healthcare.
Well, the first thing is you have to do a thorough history and physical. And when I do a thorough physical, I am, looking at you, eyes, ears, nose, throat. I'm listening to your heart and lungs. I mean, a real thorough exam.
Right.
People come in.
EKG that works.
Well, if they need EKG, absolutely.
Sure.
My patients say, "Wow, I've never had an exam like that." I said, "Well, this is how you perform a history and physical."
Right.
Unfortunately, today doctors are being educated in their residency. One complaint, 5 minutes. One complaint, 5 minutes. You're not going to learn anything about a patient there. 5 minutes.
Really?
Yeah, that's it.
So let me ask you a question. So when people come into you and say to you, I never had a physical exam as detailed as the ones that you give them, right? Medical exam.
Yep.
Does that surprise you and disappoint you at the same time? Because basically, other doctors should be doing what you're doing.
Right.
So are you like, well, I don't know what to say about that, because I'm giving you you say you never had an exam before, but you should have.
Right. Well, it's just a difference. The business model in medicine has changed in the last 30 years. I have not changed. I'm doing the same exam I learned when I was a medical student.
Right.
Nothing has changed. Nothing has changed.
Well, here's just a little heads up to the people listening. If you've noticed, the doctor's offices, a lot of them being taken over by the big hospitals and the insurance companies, all those things. Dr. Tommy is an independent physician. He's independent. He gets to spend as much time with you as you need.
Right.
He's not an employee of one of the big hospitals forced to spend no more than a few minutes before they go to the next patients.
Right.
He can spend that time with you that you require. That's why working with an independent physician, I think, is so important in developing a relationship.
Right. Well, you're dealing with the owner who's the physician.
Right.
You don't have the red tape that you have to go through. Let's say you need to, who's on call? I need to speak to my doctor. Well, you can't get through. You call the nurse's station. Well, who's on call? You don't get a call back. You're dealing with the owner who's the physician.
Right.
I'm going to call you back. A lot of my patients literally have my cell phone number and they call me directly.
Yeah.
I mean, I do have a call service, but I feel comfortable you can call me. That's when you own the business. I'm wearing all the hats.
Right.
You're going to call and speak to me directly, and I'll advise you.
Yeah.
I'm here for you.
I mean, I've gone to doctors that I've had a great relationships with, and the next thing you know, I go into their office, and they're wearing a lab coat with the name of a company on there, right?
Right.
And I'm like, you sold out. He goes, yeah. Well, and now I'm an employee.
Yes.
And now we have a whole different system, and these people are making my appointments, and it's in, out, and the personal relationship begins to diminish.
It does, absolutely. Then you have administrators telling physicians how to practice. I know I have a whole bunch of attendings who taught me. They're 10 to 15 years my senior, who, made their money, practiced in a solo practice. And I said, you know what, we want to downsize. I just basically want to clock in and clock out for the next 5 to 10 years, retire, if that. A lot of them retired over a year ago because they joined a hospital. And then you had administrators telling them how many procedures they have to do a week, because it's all about generating money. Because if you practice like I do, old school traditional medicine, it's about evaluation and management.
Right.
We do not place an emphasis on procedures other than outside of manipulation. I do very, very few procedures because I'm treating you holistically. Maybe we might have to use medications, but if I can, treat you holistically without medicine, there's very, very little procedures. So what am I billing out for my time? And insurance companies don't want to pay for time.
Right.
And then they cry about the cost of medicine going up. Well, because you're forcing the physicians to go into procedure. We are now a procedure-driven practice model. So we're so far away from evaluation management, meaning you come into me, I evaluate you, and I manage you. And together we discuss as a team how we're going to come up with a program to treat your condition. That's going bye-bye. That's not around.
It is. Because I know that these doctors are being pushed from appointment to appointment, limiting the amount of time that they can spend with you in the exam room because they're seeing more patients than they've ever seen before.
Right. An average primary care physician, 30 to 40 patients a day.
30 to 40 patients a day. And people work it out an average of 7 hours a day. Doctors don't because they get a lunch break, things like that, right? So it's probably 9 to 4, 9 to 3, whatever it is in certain days. So they're really seeing how many patients an hour. Oh my goodness, I can't even imagine.
Right.
Seven,
you're moving.
Eight?
You're moving.
You're moving.
You're moving.
And with your practice, not that you don't want to make money, you do. But after medical school for you went to the Army, right?
Yeah.
So your emphasis has always been on caring for people.
Yeah. Taking care of the community.
Taking care of the community.
I love community.
Yeah. And it pays the bills, but that has never been your emphasis.
No. Sometimes, maybe I should have gone to Wall Street right out of high school, but that wasn't my passion. I love helping people. Caring, having that relationship, that trusting relationship, and you need that call. Dr. Tommy O's here. He's here for me.
Right.
Every time I needed him, he was there. I'm there for you.
It seems that osteopathic medicine, that route that you took, really suits your personality.
Right.
Because it gives you the opportunity to really get to know the patients, really uncover their needs, and provide full care, not just partial care.
Right.
Explain that.
Yeah, well, we take a comprehensive approach. You know, I'm looking at you. A lot of times, let's say you come in with what we call a chief complaint. We'll look at it. Do I need to treat medically? Do I need to treat spiritually? And you asked me about spiritually. Sometimes you just need a hug, empathetic ear. You know, just listen and say, you know what? I can help you. Let's do this. We can do this together.
You know, that's a good point. There's so many doctors that say, "Oh, I love my doctor," but he's in and out. You don't even know them.
Right.
You don't even know what their hobbies are. I mean, it's true. It's really important to know what your doctor's into.
Absolutely.
You know,
my office, it's a museum, and it talks about the history of my family.
Right.
And my patients know about my family, my wife, my twins, and what they're doing, how well they're doing, because I want.
What are the twins' names again? Bubblegum?
Yeah, it's Cookie and Jelly Bean.
Cookie and Jelly Bean.
And Baby Cakes.
And baby Cakes is who?
Kathy.
Okay. Baby Cakes. What's your nickname at home?
I have several.
Can't say it on the radio.
But it's important that
Baby Cakes, Cookie, and Jelly Bean.
That's right.
How do you not go to a doctor whose family is Baby Cakes, Cookie, and Jelly Bean?
Exactly. Yeah. It's that personalization where the access. I'm very accessible.
Right.
I don't wear a white jacket. Okay. I want you to feel comfortable so you can approach me, and then
I've seen your scrubs. They're red, they're green, they're bright. You know.
Yeah. Actually, I just bought new scrubs last night. So, all right, we have 30 seconds. Well, Dave, I want to thank you for being on my show.
Thank you for having me.
Yes, and when's your show?
My show is starting in a couple weeks. It'll be on every day at 9:30.
9:30, and that's Back to Business with David Levenstein. All right, well, I want to thank my listeners. To learn more about my practice, go to drtomio.com. That's drtomio.com, or give my office a call at 631-980-8200. Chronic neck and low back pain, give my office a call. Involved in a motor vehicle accident, give my office a call. I will care for you.
The content heard on the Ask Dr. Tommy O show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.